Good morning, everyone. I'm Justine Turner. I'm a pediatric gastroenterologist and medical director for the Pediatric Home Nutrition Support Program at Stolly Children's Hospital in Edmonton. Welcome to our PEAS Provider Training Overview and New Tools. During this presentation, project team members will introduce themselves throughout the presentation as they speak. Today's focus is going to be to give you an overview of the new resources and tools that are available for healthcare providers under the PEAS website, access and navigation, equipment and supplies, and standardised practice and education. The Pediatric Eating and Swallowing, or PEAS project, is a provincial quality improvement initiative with the purpose of developing clinical pathways to standardise and improve the care of children with paediatric feeding disorders. For the first phase of this project, our target population has been children in the ambulatory care setting, so we focus many of our resources on outpatient and community care, but they can also be equally applied and adapted to other care settings, including the acute care setting. Pediatric feeding disorder for this project has been defined according to the definition published by Godet et al. In the Journal of Pediatric Gastroenterology and Nutrition in 2019. So this is a disturbance in oral intake of nutrients that's inappropriate for age, lasts at least 2 weeks and is associated with the following. So medical dysfunction, including cardiorespiratory compromise during oral feeding, aspiration or recurrent aspiration pneumonias, nutritional dysfunction, including malnutrition, specific nutrient deficiencies, or restricted oral intake resulting in decreased diet diversity, or reliance on enteral feeds or oral supplements to maintain nutrition or hydration. Feeding skills dysfunction, as evidenced by need for texture modification, or the use of modified feeding positions or equipment, or the use of modified feeding strategies. And last but not least, psychological dysfunction as evidenced by active or passive avoidance behaviours by a child when feeding or being fed, disruption of social function within the feeding context, and importantly, disruption of the parent-child relationship associated with feeding. And this definition excludes eating disorders or a pattern of oral intake that's actually consistent with cultural norms for that child and their family. So this work has been funded by the Maternal Newborn Child and Youth Strategic Clinical Network, who sponsor the project. So this project was actually inspired by leadership from Alberta Children's Hospital, Glenrose and Stollery Children's Hospital that had recognised there was a need for quality improvement in this area. It began with 2 World Cafes that were conducted in northern and southern Alberta with the goal of determining from multiple stakeholders that included patients, families, dietitians, nurses, pharmacists, social workers, administrators, and many others that were working, who were telling us what they considered to be working and what was not working for the care of children with paediatric feeding disorders. So this is just some examples of the issues that were raised at the World Cafe as being of concern for families and care providers, and they tended to cluster around communication, access to services, gaps in knowledge, goal setting, and providing patient and family-centred care. So these could be summarised into major themes that are showed here. And what is very interesting that these themes identified at the World Cafes were similar in their frequency across the province, regardless of whether people lived in urban or rural settings or they were in northern or southern Alberta. So using the World Cafe feedback, we applied the theoretical domains framework to develop implementation strategies in the major themes, and these were to address barriers for access and navigation, standardized practice and education, equipment and supplies, roles and implementation, and it was very important also that we undertake evaluation and feedback. And these were used to target quality improvement using an evidence-based process. At this stage of the project, we've developed a suite of tools for healthcare providers and families that are all posted on our PEAS website. We're very excited to be offering these training sessions this summer and fall, and we'll also provide additional training sessions for managers and practice leaders. And we hope you will take part in the other training sessions as well. We're also going to be actively working out details in order to still provide innovation learning collaboratives in the new year, but what they'll look like will depend on the COVID response, so stay tuned.
Great. So my name is Vanessa Steinke, and I'm the Provincial Project Manager for PEAS. And I just have the privilege of being able to share with you a quick overview of the new website. And we will dive into it in more depth in the presentation, but I'm just going to show you a few things in terms of navigating the website. So the website can be found at https peas.ehs.ca. And it's best used on a newer browser such as Chrome, Edge, or Safari. So I'll just take you into a quick tour of some of the main components of the website before we dive in a bit deeper. So you can see here on the home page that we've got the navigation bar along the top. And we've really tried to design the website so that it's very family friendly and to try to make information as transparent and accessible as possible. We've got a number of different resources for both families and providers that are shared between both sets, as well as sections of the website that are targeted to each one of those audiences. We have popular resources for families in these 8 quick links here, including a number of tools that we'll be showcasing today, such as the equipment list. Here in this blue bar, we've also got a lot of information and tools, and so we've just tried to slice and dice that a little more to show you some other questions that you might want some guidance on and just help you kind of navigate some additional topics here as well. I'll just quickly show you some aspects of the navigation bar, and like I say, we'll dive into some of those parts as well, and we just really encourage you to try it out for yourself. You've got the home button here, and then Is Feeding a Struggle is really access to the screening tool, screening for feeding and swallowing that can be accessed by family as well as healthcare providers. And then the Start Questionnaire button. And later in the presentation, Beverly will go into a little more detail about this questionnaire that we've got a link to as well. There's the Find Services here, Equipment and Supplies. FAQs I'll just land on because the other two we'll be talking about in the presentation. But for the FAQs here, you can see that you can actually select any one of these FAQs and then email yourself or email it to someone else like another healthcare provider or to a family member. You can add it to your list and then just email that FAQ to that person. The other aspect I just wanted to touch on briefly was the search tool. It's quite a powerful search engine. So I've just typed in the word goals here, but you can see everywhere the word goals comes up on the website, it will just show you tools and templates, as well as where the word goals comes up in our clinical practice guide. So just wanted to point that part out as well. And then I'll just go back to the footer and just point out a few other things in the footer. So you can contact us, connect with us, join our community of practice here along the bottom. There's also links to how to order any forms and handouts, as well as an ability for families to access our quality improvement survey just to get a sense around how services are. The final thing I'll just mention is within any section of the website, so if you're on one of the sub-pages, in addition to just the navigation menu on the left, we also have some quick links. And these quick links change depending where you are on the website, just based on things that we think you might find value in looking at as well. So I'll just go back to the presentation. And just wanted to mention that the website is also mobile responsive, and it's just another great feature and something else you can share with families as well.
So I'm Patty Okrafka. I'm the co-chair of the Access and Navigation Working Group along with Naomi Beswick, and I'll be summarizing the work of the amazing Access and Navigation team for you today. So the overarching goal of the Access and Navigation Working Group has been to explore means of ensuring sustainable, equal access to eating, feeding, and swallowing services across the province, and to facilitate ease of navigating these services. This working group started by outlining how and where the services happen through process maps. We looked at how the services are found or navigated by working with teams throughout the province to update the Alberta Referral Directory profiles to a consistent template, by creating resources for families and exploring private options. Our working group completed a workforce and wait time analysis to better understand the provincial current state of eating, feeding, and swallowing services, piloted virtual health options, and created documents for standardized services as well as referral and triage criteria to facilitate consistent access to care. We can talk about each of these deliverables in a little more detail, and all of this information and more can be found on the PEAS website. So on the PEAS website, you can find all of these resources under the Find Services heading, and the sub-menu on the left, you'll see the little hand arrow there pointing to that sub-menu on the left, showing where that services can be found. Navigation was a key component of this working group. Our working group initially drafted a flow sheet to demonstrate what a typical workflow would look like for any referral. This highlighted some of our overarching principles and values and laid a foundation for much of the other work that we pursued. We also worked with each of the zones to lay out flow maps for each area of the province to help clinicians know how to navigate eating, feeding, and swallowing referrals. These maps are all on the website and might be helpful to clinicians seeking to navigate how to access services in different areas of the province. So on the website, you can see the workflow maps. They can be found under the column on your left there. And another way of navigating services that we worked to create was a central listing of services in the province. We anticipate that this will be a navigation tool for families and clinicians that all might find useful. And you can see this in the center column on the website here. So finding services within Alberta Health Services can be challenging, with each program having a different name across the province. So we've worked together with various clinics and services involved with eating, feeding, and swallowing to compile a list within each zone, such as what is shown here for the Edmonton zone. This list contains links to the Alberta Referral Directory, as well as to other searchable Alberta Health Services directories of care, and also contains locations of service organized by zone. After working through available literature and data, we were also able to determine some wait time targets, some typical referral criteria, and a template to help organize those entries in the Alberta Referral Directory. So we worked with the Alberta Referral Directory team to align those entries across the province to include some of the consistent information. As an Alberta Health Services supported, externally available, searchable directory for the province, it was felt that utilizing the Alberta Referral Directory was the best way to ensure and maintain easy to access referral information. The Alberta Referral Directory team was able to enter consistent search terms and information in the back end of the ARD profiles to ensure that families and clinicians alike can easily find the eating, feeding, and swallowing referral information that they need from across the province. You can also find information like the access and referral targets right here on the PEAS website. For families, we also created a document outlining questions to ask and where to look if pursuing private practitioners. This information can also be found on the new website under Other Providers and Services and includes links to various organizations where private clinicians might advertise or register their services. One of the more exciting projects that the Access and Navigation Working Group supported was a pilot to trial the use of virtual technologies for eating, feeding, and swallowing services. Across the province, 3 sites participated in using virtual health for follow-up appointments. Feedback from families and clinicians alike was overwhelmingly positive, and information and tools designed to support additional sites in implementing virtual health for feeding appointments can also be found on the PEAS website. And finally, the Access and Navigation Working Group also completed a workforce analysis, interviewing managers across the province to better understand service delivery. With this information, we were not only able to understand where the service happens, but what that service looks like, who's providing it, what the demand for the service is, and what resources we have in the province to provide eating, feeding, and swallowing services. This information informed the creation of a standardized services recommendations document outlining the basic expectations of what service delivery in the province should consist of. These tools can inform managers and team leads in program development and advocacy activities.
Welcome to Standardized Practice in Education. My name is Beverly Collison. Together with Melissa LaChapelle, the AHS Provincial Practice Lead for Nutrition Services, we have the pleasure of co-chairing the Standardized Practice in Education Working Group. Over the next few minutes, we will highlight some of the supports developed for health professionals and for families. Before we do, we acknowledge the many health professionals who devoted many hours developing and polishing all of the supports that you will see today so that they would be PEAS perfect. We're excited to share the PEAS Clinical Practice Guide. The Clinical Practice Guide aims to provide evidence-based clinical guidance to enhance pediatric safety and quality of life. These are pivotal to quality improvement in a field that has clinical and ethical complexity and where very few guides and standards exist nationally and internationally. This guide provides information, guidance, and recommendations to support health professionals in making clinical decisions about screening, assessment, and management of children diagnosed with pediatric feeding disorder. At its foundation, it is meant to facilitate communication and collaboration among healthcare professionals and with families by using consistent language, definitions, and strategies. Assist healthcare professionals collaborate with families and offer clinician tips, tools, and training resources to support lifelong learning and education. Here's how to find the Clinical Practice Guideline on the PEAS website. On the navigation bar at the top of the screen, click on For Providers. It will take you to the Clinical Practice Guide. Click on Read More. This takes you to an index of the CPG. You can also click to download it. In brief, the Clinical Practice Guide spans screening through assessment, diagnosis, management, monitoring, and transition. To learn more about how the Clinical Practice Guide supports practice standards, please sign up for the CPG virtual training sessions offered in July and October. Back in 2019, PEAS inventoried current documentation systems for tools and forms specific to feeding, eating, or swallowing currently in use across the province. The AHS data group sent PEAS all relevant forms available provincially, of which there were over 100. These included a screening tool, a food record, a collaborative goal wheel, an oral feeding care plan, and an enteral feeding care plan, which is in progress. From this, the Standardized Practice in Education Working Group prioritized these 5. Part of the prioritization work included consideration of the implementation of Connect Care, recognizing that the many possible tools and forms to support pediatric feeding disorder are not currently available in Connect Care, and that we will have some sites across the province that will not be on Connect Care until fall of 2022. These forms are available through the PEAS website. Melissa will share how to access these forms with you shortly. Let's take a look at the 5 prioritized forms. A screening tool. The Feeding Matters Infant and Child Feeding Questionnaire is a remarkable online tool available for both families and healthcare providers. It leads families and health professionals through a series of questions that use smart logic to arrive at a risk statement for pediatric feeding disorder. Importantly, as families and healthcare providers work through the questions, each provides education about typical and atypical feeding and eating development. This questionnaire serves as a robust platform for families to start conversations with their child's care providers, such as their family physician. After completing the Feeding Matters Infant and Child Feeding Questionnaires, families can return to the PEAS website and click on Find Services to locate services in Alberta. Just hot off the press, a subset of the authors of this screening tool just published an article in the Journal of Pediatrics describing the psychometric properties of the Infant and Child Feeding Questionnaire. You can find it on the PEAS COP, which Melissa will be describing again shortly. The food record. A food record gives insight into a child's daily food and drink intake, diet variety, the family routine, and feeding environment. Providing families and caregivers with a food record in preparation for their visit with their registered dietitian and healthcare team can facilitate conversations and build rapport during the clinical visit. The collaborative goal wheel. This is a duplicate paper form that allows the family and healthcare provider an opportunity to co-create goals, document them, and each keep a copy. Collaborative goal setting provides a means by which to plan ahead, provide direction, and establish a clear, mutually understood trajectory of the child's management or treatment plan between the healthcare professional and parent or caregiver and across the interdisciplinary team. Parents, and if possible, child's participation in the development of the child's own meaningful goals and treatment plan provides confidence to the family that their treatment team is working in a coordinated way to help them work towards goals that are important to them. Consistency, that is commitment to one plan across the team and parent and caregiver, will improve their child's outcomes. This particular tool has been carefully aligned with the existing suite of Connect Care collaborative goal setting tools. The oral feeding care plan. A clearly defined feeding care plan is an important part of successfully managing a pediatric feeding disorder. It is an essential part of communicating and implementing safe and successful strategies across multiple care settings, such as perhaps grandparents' home, the daycare, and school. A feeding care plan is also a useful means for documenting interventions that may also require extra caution and attention, such as those related to aspiration risk or allergies. Similarly, an enteral feeding care plan serves the same function as the oral feeding care plan we just reviewed. Presently, the Standardized Practice and Education Working Group and Nutrition and Food Services are working through the many processes involved in developing a PEAS provincial form. Coming to you soon. I will now turn it over to Melissa, who will guide us through the family education materials developed by the Standardized Practice and Education Working Group.
Thanks, Beverly. As part of the project deliverables, the Standardized Practice and Education Working Group was tasked with creating an inventory of family education materials to support consistent PEAS messaging for families, improve resource access, and enhance education delivery. A large number of resources were collected from Data Group, My Health Alberta, and from clinicians across the province. The Standardized Practice and Education Working Group then reviewed each resource for content alignment with the CPG and identified which resources we could adopt, those that required adaptation, and areas of the CPG where there were no resources. We adopted over 30 resources, many of which are from nutrition services. These are posted on the PEAS website to support family education in the areas of dysphagia, texture-modified diets, feeding skill development, nutrition, oral health, and equipment and supplies. Additional resources for families have also been included, such as books and websites. Resources needing adaptation or creation were prioritized by the working group, which I will review on the next few slides. On the website, families and clinicians can access the family education materials under the For Families tab, and then visit the left-hand toolbar for oral feeding related resources. We have adapted and created several new family education materials. Gagging in babies and children is intended to be used by clinicians to support families who may be concerned about their child's gagging and need guidance. Often babies are recommended to feed in a side-lying position, either at a hospital discharge or in the community. Our new handout will support parents to understand when to do this, have a visual on proper positioning, and to offer guidance on when they can consider transitioning to a more traditional cradle hold. Although Healthy Parents, Healthy Children offers great information on feeding cues, our team felt the need to have a more targeted resource available on our website with a feeding-focused lens. Your Baby's First Taste and Introducing New Foods to Your Child handouts were born out of a need to support families where the introduction of food may not follow a typical timeline. These are intended to support infants and children with a pediatric feeding disorder, where the steps to introduction may require a gentler and more graduated approach. These will be posted to the website very soon, and all of our adapted and new resources have been reviewed by family advisors. The development of family education materials remains a work in progress. We continue to work on a handout with nutrition services to support thickening fluids for children at home. My colleague Beverly is leading discussions about resources to support children with autism spectrum disorder. Upcoming work will also focus on infant pacing and resources to help families understand the swallowing mechanism. There are still some areas of the clinical practice guide where we have not posted family education materials and hope to revisit these areas in the future. The Standardized Practice and Education Working Group has also liaised with other working groups to ensure consistency and alignment with the clinical practice guide. With regards to the enteral feeding family education materials, we took a similar approach to reviewing the existing inventory of resources. I want to acknowledge that so many thoughtful resources already existed and were in use. These were thoroughly reviewed by members of the Equipment and Supplies enteral subgroup and their colleagues for adoption, adaptation, and creation. We were successful in adopting 5 family education videos developed by the Edmonton Home Nutrition Support Program team. Upon reviewing of the existing booklets, brochures, and handouts, we were able to merge information from both programs into family-friendly, tube-specific handouts and one general booklet. Some information was reformatted to inform frequently asked questions on the website or inform the development of a handout. Family learner checklists to support discharge teaching were also adapted for provincial use. At this time, many of these resources are in the final stages of content review and formatting. For now, we have posted the original booklets. A new handout and handbook on home blended food for tube feeding has been developed by the Calgary Zone, and these are posted to the PEAS website as it was felt to fill a gap in existing materials. These resources are now being adapted for provincial use and are undergoing stakeholder review. Key websites and operating manuals are also posted to optimize the family experience and access what they need. When we go to the website, under the For Families tab, we have a tube feeding section on the left-hand side. We have several drop-down options for families and providers to view the videos, education materials, and additional resources. All order forms and family education resources posted to the PEAS website have been endorsed by the Standardized Practice and Education Working Group and PEAS Steering Committee. They can be printed directly from the website or ordered in bulk through data communications management or print services. Instructions for each zone have been included on the website for your convenience. As new forms and family education materials become available, they will be posted to the PEAS website and added to the data catalog. As part of the Standardized Practice and Education Working Group's overall education plan, we have not forgotten about you, our beloved providers. When the working group met to discuss provider education, we saw this as including 3 different strategies. The first strategy was to provide education that is foundational to practice. This foundation is built on the work of all PEAS working groups and is how we came to plan today's presentation. We hope that by offering you an overview of the PEAS project and its deliverables, that you will have the knowledge and tools you need to support your practice. Secondly, we heard from clinicians across the province that both advanced practice and mentorship opportunities for those new to this area were needed. PEAS invites providers to connect with mentors to promote ongoing knowledge transfer and skill building. This in turn enhances the quality and equity of pediatric care provincially. Thirdly, PEAS has created a community of practice SharePoint site where we invite you to connect and learn from each other. We hope that this community will grow and evolve organically over time with leadership from provincial practice leads and all health professionals. We encourage you to join and participate in the conversation. As you can see, the website offers a quick and easy access point for providers to access a wealth of resources, including access to the Community of Practice page. Once you head over to the Community of Practice web link, AHS providers can join the community and begin posting. Membership may be requested to the SharePoint administrator by providers who are external to AHS. We are really excited for you to join the conversation.
Hello, I'm Mary O'Gorman. I'm a unit manager at the Alberta Children's Hospital for Unit 2, and I am also the manager for the Home Enteral Nutrition Program. I am a co-chair of the Equipment and Supplies Working Group, along with Dr. Justine Turner and Heather Lissel. This next section focuses on the work completed by the Equipment and Supplies Working Group. This working group was subdivided into 3 groups: enteral feeding, equipment and supplies, oral feeding, and funding accessibility. The aim of all the equipment and supplies working groups is to provincially align practices related to the selection, provision, and use of enteral and oral feeding equipment and supplies, to provide families with information to support successful feeding and positive feeding relationships with their children, to align practices with evidence-based information wherever possible, to facilitate information sharing amongst practitioners, and to provide family access to the same information as practitioners. In order to ensure all children with feeding tubes have access to what they need and to minimize overuse or waste, the enteral feeding and supplies working group has developed supply guides for monthly orders. Supplies are categorized by both NG and G tube quotas. Quotas have been aligned across both the Stollery and Alberta Children's Hospital's home enteral programs. For families who have been on the program for more than a year, they will see changes to the types and amounts of syringes, reduction in the types of creams, tapes, and dressings, reduction in the number of bags provided from 1 bag per day to 1 bag every 3 days, or roughly 10 bags per month. The PEAS Steering Committee decision to reduce the number of bags was based on information obtained between 2004 and 2019 in an evidence-informed rapid review. Bag reuse up to 72 hours was reported to be safe based on information from the National Clinical Guidelines Centre in 2012. Published Canadian guidelines exist also for bag reuse up to 72 hours, and these publications are from both BC Children's Hospital and BC Women's Hospital, as well as Montreal Children's Hospital. There are some children for whom 1 bag a day will still be provided. And these children include those who are immunocompromised, who are J-tube fed, are up to 6 months post-transplant of any type, heart, liver, kidney, bone marrow, or are premature infants up to 4 months corrected age. In addition, the website has forms that families may use to order their supplies from either of the programs in Edmonton or Calgary. For families who wish to purchase additional supplies, whether that be syringes, bags, backpacks, etc., there is a provincial list of vendors that carry Cardinal Health products. Families should call ahead to ensure the vendor has the available products on hand. Also on the website, care providers and families can find a searchable equipment and supplies list. This is intended to be a guide that clinicians can use in their discussions with families and also a resource for families to do their own searches for supplies. The supply list can be filtered by a developmental stage or category, and the search function can be used to look for what they need. Users also have the ability to email the item to themselves or others. Under Family Resources, in the section on tube feeding, you'll find videos that demonstrate insertion of a McKee G-tube, a balloon gastrostomy tube, and an NG tube. There's also a great video listed, which is a resource for families and gives providers a glimpse into family life and coping with home feeding. Resources that support oral feeding include handouts on choosing an appropriate bottle nipple, high chair purchasing considerations, choosing a soother, modifying a high chair, and building a table for a booster seat. The bottle nipple handout guides users in selecting a nipple with the appropriate length and shape to support a good latch, plus how to select a nipple with the correct flow rate. The soother selection handout provides similar advice on choosing a soother with the correct shape to facilitate healthy sucking. The Modifying High Chairs handout offers guidance to families on how to use common household items such as blankets to help them provide better support to a child while sitting in a high chair. All of these resources are available on the website and can be printed as well. Finally, if you or your families are looking for funding-related resources, this section of the site describes the various sources of funding. It includes brief descriptions of the various government-funded programs, such as FSCD, or Family Support for Children with Disabilities, and the Alberta Child Health Benefit, plus links to their websites.
Hi everyone, my name is Melanie and I'm a unit manager overseeing rehab services, programs and staff at the Alberta Children's Hospital. I have the privilege of co-chairing the roles and implementation working group with Vanessa Steinke, Senior Project Manager and Lead Project Manager for the Peace Project, and with Tricia Miller, who's the Manager of SLP, Audiology, and Children's Allied Health Services in the South Zone. Our group members have put hours and hours into the work of developing a robust interprofessional collaborative toolkit for PEAS care provision. A huge thank you to our teammates for their time, energy, and passion. As was mentioned earlier, stakeholders across the province identified collaboration and role clarity as the second most influential factor to providing quality care for children and families. This propelled our group to work with clinicians, families, AHS Health Professions Strategy and Practice, COACT, and our regulatory bodies and colleges to develop a suite of tools related to collaborative practice and roles, which can be found on our PEAS website for both healthcare providers and resources oriented to families.
Thanks, Melanie. Also want to note that we have so much great content and tools related to collaborative practice and roles. We will be presenting this as a separate topic as part of the learning series. Those occur July 30th and November 5th. So please be sure to sign up or watch for these training sessions. Thank you.
Okay, so last but not least, I'm going to talk about the evaluation portion of the PEAS project. And I'm presenting this on behalf of myself, Justine Turner, and Mark Morland, who's my co-chair for the evaluation working group. So as PEAS is a quality improvement initiative, we do hope that families will experience improvement in care quality and health outcomes as we roll out the project. One way to help us measure and focus on continuous quality improvement is through a short 5-minute survey that we've listed here on the PEAS website. Families are invited to participate in this survey after each eating, feeding and swallowing visit, and we're working on a dashboard to help report the overall outcomes in real time for care providers. You can learn more about this quality improvement section on the website. So you can contact us by email or using the PEAS contact form, which we'll show you on the next slide. And for example, we would really value your input, including any suggestions for additional tools of handouts that you would find useful or know about that we haven't had here. So this is the contact us form on the website. Please also consider subscribing to upcoming news and events through the website. So we want to thank everyone who's been involved in this project, particularly the working group co-chairs and members and all the work that they've done, the steering committee and leadership team for their oversight and leadership, and very importantly, our family advisors, and also our project leader, which is Vanessa Steinke, who really has moved this project forward. Okay, so thank you very much for participating today. Please consider completing our 5-minute survey regarding your feedback on this first virtual training session and on the PEAS website. We look forward to having you attend the future webinars. Thank you very much. And now we'll be able to take questions or have comments.
Thank you, Carolyn, for your kind comment there. We are really excited for all the tools that are coming together and the amazing work that people have pulled together provincially.
Hi, it's Joan. I'm just thinking for the virtual, which I think are a great idea, the virtual follow-up appointments for the feeding therapy. If growth has been a concern, like one of the things we do in person is a weight and a length, and so I'm just curious, will they be required to go to their pediatrician or family physician, or will a home measurement be adequate, or have you thought about a process for that?
That's a great question. I guess, Naomi, do you want to take that, or anyone on the phone?
Sure. We've been doing quite a few virtual health visits here. So typically those would be kids we're doing follow-up for. We have done a few kind of initial visits. I think the safest answer, to be honest, would be it would depend on the service, because the service is going to make the decisions about what information they need and also what information they need for each individual child. So I think if you're connected to a service, that it would be better to talk to them about what they would need. I haven't heard from our people that we're mandating people going to physicians to get weights and measures at Glenrose. So, you know, I think, as I said, I would defer to the services that you're dealing with.
Okay, thanks so much, Naomi. We'll just move on to the next question here. I think that someone was asking about directing me to the information on inpatient referral to HENT. So,
Mary, so I'm assuming that was directed to ACH, so I just did reply in the chat services as well, so that if that is an inpatient, then it would be on SEM, or it could be done on a DDR if they're ambulatory.
Wonderful, thanks. I'll just point.
At Stollery, obviously ours is through Connect Care at the moment, our referral forms.
Mm-hmm. I'll just point out when you're on the website as well, if you're wanting to look for services, if it's an AHS service, click on Find Services, go to AHS, and then we've got these links to the various directories. There's many different directories out there, but we've tried to collate some of them into the this list here and tried to be as comprehensive as we could. So for instance, Justine was just mentioning HNSP, which is the home nutrition clinic in Edmonton. So if you click here, it takes you straight to the Alberta referral directory profile, where you can find the referral form and the process. And then similarly in Calgary, you can click down and see home enteral nutrition therapy, and again we've got their Alberta referral directory profile, but do use the process that Mary, the manager of that clinic, has said as well. I hope that answers your question. Okay, we'll go on to the next question here from Crystal Axworthy. Will we be able to use the AHS forms? I am from the primary care networks. Absolutely. So all of the forms can be found, well, in a few different places actually. We just tried to repeat the information, so depending on where you're coming at it, you can find it. But if you're on the For Providers section and looking for forms, just click on For Providers and then the clinical tools, you can click Read More. And each one of the tools that we talked about are located here. So for instance, Beverly showed the food record. You can download that form and just print it off straight from the website. So those are all here. If you're wanting to order in bulk, we're also just working through a process right now with Data Group, and it should be posted any day now. We're just on the final touches, but if you click on order forms and handouts in the bottom footer, you can see that we've got a place here, and we'll be posting this option for people who are from the public or outside of AHS to be able to order forms in bulk. So they'll be in packs of 25. Same thing with our education materials. You can order those education materials if you're thinking about getting them in bulk, and there'll be a credit card option for people from the public, and you can have it delivered to your doorstep. If you're within AHS, then please just go through the regular process of usually going through your clerical staff to order forms as well. I hope that answers your question, Crystal. Okay, we'll move on to the next question then. Charlotte, do you have weight management resources available, for example, for a teen with PCOS? Melissa?
Nutrition Services does work with the Pediatric Weight Management Program, and those resources were not within the scope of the PEAS project, but I can probably find you some information after this session.
And I think Charlotte also asked about growth charts, and I think, Melissa, that would be the same answer, that through nutrition services that they're available, right?
Yeah, growth charts. So the Provincial Growth Measurement Protocol and all related tools and resources are accessible on the AHS external page. And so those can be found there. I'm not sure if there have been any updates related to COVID, so that is something I've noted as a follow-up in relation to Joan's question previously. But we haven't posted the growth charts or that link actually to our PEAS page, and so that may be something that we can consider adding as a resource link.
Great questions. And I'll just also make a plug that after this presentation, you'll receive a survey, or you can send us your comments and feedback on the Contact Us form too if you have other suggestions. We're always looking to improve. Thanks, Melissa. Okay, it looks like both those questions were answered. Thank you. And then Heather, you notice that the South Zone Pediatric Nutrition Counseling Services aren't online. So yeah, we probably have some gaps here, and that's something we can absolutely look to add. Thanks, Heather. I'll just go and click over there while we're at it. Is there a downloadable assessment protocol form?
Hi there, this is Beverly. I'm happy to answer this question. We're really excited. This is a shameless plug for to invite you all to join us when we review the clinical practice guide. The clinical practice guide is divided into sections including screening, assessment, and management, as well as transitions and discharge. And within the assessment section, we can find lots of good resources for moving through an assessment that's built on the work of G'day as well as the New South Wales practice.
Okay, does that answer your question, Cynthia? Thanks so much. I'm just looking here to see, there's another comment here from Constantina. I'll just pull it over so people can see it. or maybe you can see it already. I'm not a member of NHS. I'm a speech language pathologist living in Greece. Is there material and forms free for download? Yeah, absolutely. So it's actually AHS as much as we love NHS as well. Alberta Health Services, wonderful that you are accessing us from Greece. Welcome. And yes, you can absolutely download any of our materials and print them for your own use where you find them applicable. It does have the Alberta Health Services logo on them, but certainly it's something that you can use.
And this is Justine. I just wanted to make a comment about that. So we made a very deliberate choice with this project not to have the provider section password protected or accessed that way, but basically open to the public so that, you know, all the advice and recommendations were transparently shared between providers and actually patients and their families.
Yeah, thanks. Great point.
So thank you very much for participating today. Please consider completing our 5-minute survey regarding your feedback on this first virtual training session and on the PEAS website. We look forward to having you attend the future webinars. Thank you very much.